Good evening, everyone. My name is Natalie Moyes. I'm an assistant professor at Columbia University Medical Center. Thank you for having me here. So today we're going to be discussing blood pressure. So we'll be discussing high blood pressure, some of the basics in terms of what causes high blood pressure, the dangers of high blood pressure, how we can diagnose elevated blood pressures, in terms of where we should be measuring blood pressures at home and in the clinic, and also how low we should go. So what are the new goals based on recent guidelines? And then what do we do when we actually find out that our blood pressure is high? Now what? So we'll take a little bit of time to discuss that as well, before focusing a little bit just based on popular requests, low blood pressure, in terms of what causes low blood pressure, and how we can actually treat low blood pressure as well. So let's get started on the basics of high blood pressure. So high blood pressure is very common in New York City. About 1 in 4 individuals in New York City have high blood pressure. So it's more common in older individuals, and particularly common amongst African Americans, Hispanics, and Asians. There are usually no symptoms, so it can actually often go overlooked. So what is blood pressure? So blood pressure is the force of blood moving through your vessels, and higher levels can damage those blood vessels, right? So high blood pressure, the top number measures systolic blood pressure, which is the pressure in the arteries when the heart beats. The bottom number measures the pressure when the heart relaxes, right? And so what actually causes high blood pressure? So your vessels are usually like elastic pipes, and blood moves easily through them in a normal, healthy individual. But as people age, those big elastic arteries become more stiff, and this can cause high blood pressure as the heart has to pump harder to force blood out of the heart. So usually there's really no cause of high blood pressure. This is usually just a normal aging process, but there are a lot of risk factors as well. So age, as I talked about, race, particularly amongst Blacks and Hispanics, family history, weight, also sets you up for having an increased risk of having high blood pressure. Family history, smoking, your diet, especially if you're eating diets high in salt, alcohol, stress can also affect your blood pressure, and a lot of medical conditions. So high blood pressure is more common in individuals if you have diabetes, or if you have kidney disease, or something called sleep apnea, where individuals may snore or stop breathing in the middle of the night. What are the complications of having high blood pressure? Why is it so important to treat? So high blood pressure can harden the vessels, causing plaques made of cholesterol to build up on the lining of those vessels, leading to a heart attack, which happens when there is a clot or block in the vessels, causing damage to the heart. High blood pressure can also cause strokes, bleeding in the brain, aneurysms, heart failure, kidney disease, and thick, narrow, torn blood vessels in the eye, trouble with memory or dementia, and also sexual dysfunction. So how do we diagnose high blood pressure? So hypertension remains this powerful risk factor from dying from stroke and heart attacks. The higher blood pressure is above 120/70, the higher your risk of having a stroke or heart attack. So based on this, on all of this kind of epidemiological literature, guidelines have changed recently based on this data, and also on recent trials testing the effect of lower blood pressures versus the higher goals of 140/90, which we've used for many years. So in the past, your doctor would tell you that you have high blood pressure if your blood pressure was above 140/90. But now there's been a shift, and high blood pressure is considered anything above 130/80 for many individuals, but not all. Defining high blood pressure continues to be made on an individual case, where your doctor kind of looks at you as an entire individual and looks at your risk factors and things like age to determine whether or not your blood pressure is in fact above goal. But based on some of this newer data, increasingly physicians are using 130/80, but this may not always be the case for everyone. So how do we measure our blood pressure? So figuring out whether or not you meet this cutoff of 130/90 continues to be done in the clinic setting. So if your blood pressure is elevated 2 times in the clinic, you can be diagnosed with high blood pressure. Because clinics are very hectic places, some of these newer guidelines by the ACC and AHA recommend trying to get an accurate blood pressure by relaxing for 5 minutes first, not talking, making sure that you remove any clothing, and not taking your blood pressures on exam tables with your feet dangling. These newer guidelines really emphasize proper technique in the office setting. But there continue to be a lot of problems with measuring your blood pressure in the clinic. About 1 in 5 individuals will have something called white coat hypertension. And often those individuals don't actually need medications. So in those individuals, their blood pressure may be high in the clinic, but completely normal at home. And then there are many other individuals, particularly African Americans, who are more likely to have masked hypertension, where their blood pressures are normal in the clinic, but actually very high at home. And so because of this data, the newer ACC-AHA guidelines that were put out in 2017 also recommend using home blood pressure monitors more often, especially because home blood pressures are better at predicting outcomes such as stroke and heart attacks than clinic blood pressures. So how do you measure your home blood pressure? Most pharmacies now can provide you with a home blood pressure monitor, and your doctor can usually write you a prescription for this. So based on these newer guidelines, they recommend checking your blood pressure at home. So you should ensure that you don't smoke, eat, drink coffee, or exercise 30 minutes before you take your blood pressure. And very similar to the clinic setting, sit quietly for the first 5 minutes, sit in a chair, roll up your sleeve, make sure your back is supported, and make sure you follow the instructions for putting on the cuff that may be specific to the device that you're given. If you're unsure, you can always ask your pharmacist or your doctor. The next steps are taking the blood pressure more than once. So many individuals just take the blood pressure once. It's really better if you take your blood pressure twice, at least 1 minute apart. Make sure you write your blood pressures down and bring it to your doctor's office. For diagnosing whether or not you have high blood pressure or whether or not you have white coat hypertension, it's best to take measures in the morning and night for at least 1 week. Checking your blood pressure accurately is important because things like having a full bladder, as one example, can increase your blood pressure by almost 10 millimeters Hg. So for an example, if your blood pressure says 150 millimeters Hg, you may actually be less than that. You may actually be 140 because of improper techniques such as talking or having a conversation when you're taking your blood pressure, not having your arms supported, having your legs crossed, or not having a supported back. So it's very important that you follow these simple techniques for getting an accurate blood pressure reading, whether it's in the clinic or in the home setting. So other options for getting your blood pressure tested out of the office is something called a 24-hour blood pressure monitoring. So Columbia University has a 24-hour blood pressure monitoring service, which allows you to measure your blood pressure for 24 hours, including daytime and nighttime measures. This allows you to know whether your blood pressure is elevated even while you're sleeping. Pharmacies and kiosks around New York City also have places to measure your blood pressure outside the doctor's office. So, my doctor says my blood pressure is high. Now what? So blood pressure goals for many individuals now, according to these newer ACC-AHA 2017 hypertension guidelines, is less than 130/80. But this may vary on individual factors like age and other medical problems. If your blood pressure is above 140/90, these newer guidelines suggest medications. But again, this is an individual decision based on your risk factors and your doctor's decision. If your blood pressure is in the middle range of 130 to 139/80 to 89, then you may need medications if you have risk factors or heart disease, like diabetes, kidney disease, stroke, or heart attacks in the past. Otherwise, those at low risk or with just a little elevation of their blood pressure, such as 120 to 129, can change their lifestyle. Again, these goals will depend on the individual and should be made with your doctor. So how do we change our lifestyle? So, these haven't changed for years in terms of the best ways to kind of prevent and control high blood pressure and weight and other medical problems. Eating better, limiting your salt, limiting your alcohol, exercise, and quitting smoking are really important to managing your high blood pressure. Try to check the nutrition facts for sodium. You'll see that, for instance, here, you'll see that the frozen peas only have 125 milligrams of sodium, and the canned peas have 380 milligrams of sodium. Ask your doctor to send you to a nutritionist who can also help you learn how to read these labels, especially if you have elevated blood pressures and your doctor is recommending lifestyle changes. Another way to bring down your blood pressure is exercising moderately. So it's important to know what moderate level physical activity includes. So this includes wheeling oneself in a wheelchair for 30 minutes, walking 2 miles in 30 minutes, so that's 1 mile every 15 minutes. So that's a brisk walk, running, or even dancing fast for 30 minutes. And then finally, a lot of people will be started on medications by their physicians or are already taking medications. Make sure that you take your medications as prescribed. There are many medications for high blood pressure, and it's important to find the one that's the right fit for you. So some people skip doses because they don't feel sick, or they're worried about side effects, or their blood pressure is getting better, so they think that it may not need the medications anymore. However, it's really important that you not skip medications or stop your medications, as this can lower your risk of stroke and heart attack. Try to talk to your doctor if you don't feel well or are having side effects, because there are a lot of options these days for blood pressure medications, and your doctor may be able to help you find the one that's the best fit for you. So here are some tips for remembering to take your medications. I know a lot of my patients often forget to take their medications. So having a favorite picture of a loved one with a note next to it saying, remember to take your medications, keeping your medications next to your bed or your toothbrush, having sticky notes in your fridge, mirror, and door, or a buddy system or a child to help you remember are really effective ways to help you take your medications every day. You can also use a pill box, which is available in many pharmacies as well. Set a reminder on your computer or phone, and be sure to refill your medications 1 week before they run out. So here's a case to see if we have been able to kind of understand what is high blood pressure, how do we diagnose it, and how do we treat it. So Maria is a 62-year-old woman, and she's recently been told by a doctor that she has high blood pressure. She gained 10 pounds over the last 5 years. She takes naproxen for joint pain, has never smoked, drinks about 2 glasses of wine every day. Both of her parents had hypertension in their 60s. Her average blood pressure over 2 visits is 142/90 while seated in the clinic. She checked her blood tests and urine, and they were all normal. So what's the first step? Right, so she should check her blood pressures at home to confirm those clinic blood pressures. So she checks her blood pressure every day and night for 1 week. Her average blood pressure over that time is 138/89. Is that considered high? So yes, based on the newer ACC/AHA guidelines, this would be considered higher blood pressure. But again, this may differ based on individuals and on your physician. So her next step is that she has no high risk factors for heart disease. So she doesn't have diabetes or kidney disease. So her doctor recommends that she limits her alcohol, stops her naproxen, so medications, pain medications like Motrin, naproxen, and any of the other kind of anti-inflammatory medications can increase her blood pressure. So he recommends that she stops that medication, she lowers her sodium intake, and that she starts seeing a nutritionist to help her lose weight. So the end of the case is that Maria returns 4 months later, and now her blood pressure is 128/72. She stopped the naproxen, only drinks once in a while instead of 2 glasses daily, takes less than 2,000 milligrams of sodium a day, and lost 3 pounds. She's still checking her blood pressures at home once a week. So now let's move on to how low is too low, low blood pressure. So low blood pressure really depends on the person. What is normal for one person may be abnormal for another. So usually and generally, low blood pressure is considered anything less than 90/60, and which also causes symptoms. So symptoms include dizziness, fainting, blurry vision, fatigue, cold or pale skin, but these symptoms are not always specific to low blood pressure. There may be something else going on at that time. So causes may range from dehydration, so you're not taking enough water in, to serious medical or surgical disorders like infection or bleeding. Medications such as blood pressure medications or Viagra or Cialis can also lower your blood pressure. Just like high blood pressure is a normal part of aging, low blood pressure can also be seen more often in older individuals. Diseases like Parkinson's, diabetes, heart disease, thyroid, or hormonal imbalances can also cause low blood pressure. Some individuals have lower blood pressure associated with eating or excess heat or varicose veins, pregnancy, and then a lot of different individuals just run low. So the first step really is to talk to your doctor. Your doctor may decide to check labs or your heart function, or if it's quite severe, send you to an urgent care center. Many of the times, however, there's no cause and no treatment is needed, especially if you don't have any symptoms. Treatment really depends on the cause. So you may need to adjust blood pressure medications. Your doctor may decide that you need a higher salt intake, but this again needs to be done under the careful supervision of a doctor. You may need to drink more water, particularly in more humid times of the year, such as summer. Wearing compression stockings, sleeping with your head elevated, and trying to stand or sit up slowly are other ways for you to kind of treat lower blood pressure. Some individuals may also need to eat small and frequent meals, again, depending on the cause of their low blood pressure. In conclusion, high blood pressure has no symptoms but can often cause heart attacks, stroke, and kidney disease, particularly when left untreated. Blood pressure above 130/80 is considered hypertension according to newer ACC/AHA guidelines. But again, this depends on the individual and your treating physician and needs to be made on a person-by-person basis. Treatment includes exercise, diet, and medications. Blood pressure is too low if it is less than 90/60 or if it's causing symptoms like dizziness or fainting. Low blood pressure can be due to aging or dehydration or be a sign of something dangerous such as heart disease, infection, or bleeding. Thank you for having me, and please let me know if you have any additional questions.